This tiny blue pill can help your sex life or send you to the hospital if you mix it with the wrong things. Before you take Viagra, you must know these 5 dangerous mistakes. This little blue pill is Viagra, also known as Sildenafil. In this video, I'll explain 5 things you must avoid when taking it. Number 1, never mix Viagra with nitrate medications. So what are the nitrates medication? Nitrates are medicines used for heart problems, like angina. Examples include nitroglycerin, isosorbide mononitrate, and isosorbide dinitrate. Both Viagra and nitrates relax blood vessels. Together, they can cause a sudden, severe drop in blood pressure, which can make you dizzy, faint, or seriously ill, even life-threatening. If you take nitrates, do not take Viagra. Number 2, avoid recreational drugs. Some recreational drugs are very dangerous with Viagra, especially amyl nitrite, also called poppers. This combo can crash your blood pressure fast. Other drugs like cocaine or MDMA, they're not properly tested with Viagra, so no one truly knows the risk. If you want to be safe, don't mix Viagra with any recreational drugs. Number 3, be careful with alcohol. Alcohol isn't a strict no, but here's the truth. Alcohol can cause erectile dysfunction, can reduce how well Viagra works. It increases side effects like dizziness. If you're taking Viagra for ED, limit alcohol or skip it completely. Watch out for alpha blockers, prostate or urine meds. These include medicines like tamsulosin, Flomax. They're used for prostate enlargement, urination problems. Taking them with Viagra can make you feel faint. It's good to tell your doctor you're taking Viagra. Leave a 6-hour gap between the medicines. Be stable on one medicine before starting the other. Number 5, avoid grapefruit and certain antibiotics. Grapefruit slows how your liver removes Viagra. This means higher Viagra levels in your body, more side effects like headaches, flushing, and low blood pressure. Skip grapefruit when using Viagra. Some antibiotics and antifungals. These medicines affect how Viagra is processed. Fluconazole, itraconazole, clarithromycin, erythromycin. They can raise Viagra levels unexpectedly. Always tell your doctor you're taking Viagra. Liver or kidney problems. If you have liver or kidney disease, you may need a lower dose. Taking too much can be unsafe. Always check with your healthcare provider. If this video helped you, watch my next video where I cover the most serious men's health problems, from erectile dysfunction to testicular issues. Thanks for watching. See you there.